जय जगन्नाथ। शुभ संध्या। महर्षि महाविद्यालय रोभर रेंजर दल आनुकूल्य अनुष्ठित 177तम आभासी कार्यक्रम रे एक बिंदु रे जोग देइथिबा समस्त दर्शक मानकु मु डॉक्टर नमिता पट्टनायक being the host and convener and Assistant State Commissioner Odisha State Bharat Scouts and Guide, welcome all of you to this Google platform. नीलाद्रौ शङ्खमध्ये शतदलकमले रत्नसिंहासनस्थं सर्वालङ्कारयुक्तं नवघनरुचिरं संयुक्तं जाग्रजेन भद्राय वामभागे रथचरणयुतं ब्रह्मरुद्रेन्द्र वन्द्यं वेदनं सारमेशं सृजन परिवृतं ब्रह्मदारु स्मरामि। परम कारुणिक अनंत कोटि ब्रह्मांडर मौडमणि कोटि कोटि ओडियांकर हृदयर आराध्य देवता समग्र विश्वचराचर स्रष्टा आनंदकंद परमानंद सचिदानंद अखिल रसघन विग्रह विश्ववेदनार वैद्य देवाधिदेव श्री श्री जगन्नाथंक चरण कमल रे कोटि कोटि प्रणाम। I offer my respectful obeisance unto the lotus feet of our spiritual Guru Lord Sri Jagannath. It is an initiative to inculcate the health hazards, whatever is going on among the people of not only Odisha but also in India, all over the world. We have to take action, how to go for awareness campaign, being a volunteer and awaken the entire society and to promote their recovery or to help them to lead a healthy life. This is our motto. So I'm thankful to all the volunteers to join for this noble cause. Respected Mrs. Manju Patnaik ma'am, the principal Maharishi College of Natural Law, the president of this 177 national winner, esteemed Dr. K.P. Mishra Sir, the national vice president Bharat Scouts and Guide, and the state chief commissioner Odisha State Bharat Scouts and Guide, being the chief patron of this webinar, revered Professor Dr. Jayant Kumar Panda Sir, SCB Medical College, Cuttack, one of the oldest medical college in Odisha. Respected Mr. NIRANJAN ROUTRAY, reader in zoology, BANKI Autonomous College, BANKI. My dear Prof, Dibyansu and Preeti from Paradip, and all the professors, teachers, adults, volunteers of our Scouts and Guides, the staff member of Maharishi College of Natural Law, and the media personnel, and all of you, those who have made this program a grand success. Now, we are going to request our National Vice President, Bharat Scouts and Guide, and the State Chief Commissioner, Bharat Scouts and Guide, to Dr. K.P. Mishra sir, to inaugurate this program virtually. Dr. K.P. Mishra sir. Thank you, sir. Now it's time to welcome our sir, Professor Jayant Kumar Panda sir. May I now request Preeti? Are you there? Dibyanshu?
Yes, ma'am.
Okay. Just start Sloko.
Namaskar, ma'am.
Namaskar.
ॐ वक्रतुण्ड महाकाय सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा ॐ कदाचित् काळिन्दी तटविपिन सङ्गीतकरवो मुदाभिरीनारी वदन कमला स्वादमणुवः रमा शम्भु ब्रह्मा मरपति गणेशार्चितपदो जगन्नाथ स्वामी नयन पथगामी भवतु मे मुझे साभे वेणु शिरसि शिखिपिञ्चं कटितटे विपुलं नेत्रान्ते सहचर कटाक्षं विदधते सदा श्रीमद्वृन्दावन वसति लीला परिचयो जगन्नाथ स्वामी नयन पथगामी भवतु मे. Thank you.
Thank you. Thank you. Thank you very much. Now, Preeti, get ready. While I'm introducing our chief speaker of today's evening, you get ready for your program. As all of you know, today we are organizing 177 national webinar where we have obliged to get such a brilliant scholar and one of the reputed professor and doctor medicine from Odisha. He is none other than Professor Jayant Kumar Pandasha. He was the head of the department of PG Department of Medicine in the last many years. When he joined as one of our guest chief speaker in during Corona, and he has given us enough knowledge and strength to lead the life happily during those periods. Now, it's my duty to introduce our guest of today's evening, Professor Panda, who is not only a small doctor or a lecturer, not only that, he is above all a good person and very approachable doctor. Nowadays, they are very much busy in their schedule. However, I never talk to him over phone. Can you believe? Only a small letter request, and he has accepted our invitation. So thanks to you, sir. I'm really obliged, and I again thanks to you on behalf of principal and all the staff member of Maharshi College of Natural Law. It's a great person to get in this occasion on this platform and giving time for 1 hour. It's really amazing. Thank you, sir. He is the Vice Dean of Indian College of Physicians, that is ICP. And you know how much qualified he is. He is the MBBS and the MD in internal medicine, but that is not the only thing. He has completed all the fellow diabetics in India, consultant in diabetics, metabolic and the critical care medicines, FIMA, MS, all these FICP, FSCP, all those qualifications which are required for his not only to get education, but to educate us, like the people or the public. And he was he is the immediate past national president of CCDSI, immediate past chairman of API Odisha State Branch, chairman elected as RSSDI Odisha, and most of this, he is the organizing secretary of RSSDI 2017, member of the advisory council and advisory council of governor SCP in India, and he is also the member of CWC and IMA, member of ECAI, AARO, all these organization related to medicine, medical activities, only not only to be a member, but to be active member and gain knowledge. This is the motto of Dr. Panda. He is the state president of Odisha Medical College Teachers Association, just like all the teachers having their own association. He is also the president. So, president of Kotak Club and 71 national and international publications he has got, and principal investigator of international and national trials in Odisha. So we are really, he's having more than 20 pages of biodatas, the CV, and just extracted few points for your information. But I know, as a very popular doctor, not only from SCB Medical College, as a whole, everybody knows him, and his smiling face will cure naturally 70% of our disease. So thank you, sir, for being with us. Now, I'll request Preeti Pragya to enchant your sloka. Then, sir will speak to us. If we'll continue, will be better. Yes, Preeti, are you there? Yes.
Yes, sir.
Ah, okay.
A very happy evening to one and all present over here. This is Preeti Pragya. I'm studying in class 9 in Kendriya Vidyalaya Paradip. Now I'm going to chant Shri Krishna Stotra. वन्दे नवघनश्यामं पीतकौशेयवाससं सानन्दं सुन्दरं शुद्धं श्रीकृष्णं प्रकृतिः परं राधेशं राधिका प्राण वल्लभं वल्लवीसुतं राधासेवितपादाब्जं राधावक्षस्थलस्थितं राधानुगं राधिकेशं राधानुकृतमानसं राधाधारं राधाधारं राधासेवितनामितं राधाहृत्पद्ममध्ये च वसन्तं सन्ततं शुभं राधासहचरं शश्वद्राज्ञापारपलीततं ध्यायन्ते योगिनो योगात् सिद्धा सिद्धेश्वराश्च तं ध्यायेत् सन्ततं शुद्धं भगवन्तं सनातनं भगवन्तं सनातनम् ॐ श्री कृष्णाय नमः.
Okay. Thank you, Preeti. I'm really grateful to you, small guys. You are always helping us. Chanting means inviting God to our platform. Thank you very much. Now it's time to have a very small look to the fact about the program. Odisha has been hit by a deadly disease, which all of you might be knowing. This is called scrub typhus. So, resulting in the death of 6 people just in the last week, we could able to listen that from Sundargarh, 5 people from Bargarh, and there are 11 people are still affected, and some of them from Balangir. So, thing is that we have from the January till today, 100 more than 132 scurf typhus positive cases have been detected. Yes, sure. It's not that it has been tremendously affecting the people, but uh, better it is affected in the western side. It might be difficult for all of us to listen from this start, because we know it may affect all other people if we will not take prevention. So, scurf typhus, as all of you know, it is referred to just like a bush typhus. It mites small kiddas like things, Mites means a very small creature like a spider that lives on the plant and animals, or in our carpet also, and that affected. This scrub typhus is also just threatening the infection caused by the bacteria, which is Sar will tell us, and it is transmitted from human by bites and from tiny infected mites. This transmission to human mostly occurs through mites of chiggers, which are infected from the larva of the mites. And chiggers are also called berry bogs, bush mites, red bogs, crab itches, so many things. So these are the knowledge we have got. But the scientific knowledge which are required for the knowledge about this typhus, let us listen from Dr. Panda. So now the floor is with you, sir. And let us listen to Professor Panda about the signs, symptom, diagnosis, treatment, and how to make ourselves cure or prevented ourselves beforehand. Over to sir.
Thank you, Dr. Namita Patnaik, ma'am. It's a privilege speaking to the family of Maharshi College of Natural Law, the Rover Ranger unit, as well as the whole family of Maharshi. And it's good that you are spreading the awareness, making others aware about a social importance of a disease. And I'm very delighted that you have chosen me to speak this topic to your group of members and the beneficiaries. I'm sharing my slide. Enter screen, good, no?
Okay.
My slides are seen, ma'am.
Yeah. I'd like to intimate you, sir.
Huh.
There are friends from international. I like to introduce Mr. Dilip Kha from New York. He was waiting since yesterday to listen to you.
Yeah, great.
Good
Uh,
evening, everyone.
Slides are changing.
Yeah. Yes, sir. Is turning.
Changing, yeah.
Okay.
So it's a great honor that we are discussing scrub typhus today, and I'm happy to know that Mr. Dilip is here, and all Maharshi family is here, and then I'll be happy to share some important fact about this disease.
Thank you.
And you know,
Thank you.
welcome, Mr. Dilip and the whole family. Actually, the issue is that one after another, the diseases are threatening the society and the mankind. You know, after the COVID pandemic, where everybody was scared of viral illness, even dengue is active in the state, and we have many admissions and many morbidities related to dengue virus, and we are fighting it out. And no sooner did we relieve from the viral illness, another rickettsial illness, the scrub typhus, has cropped in. And I'm amazed. Namita ma'am has so quickly picked up the social problem and wanted to update all of you about the illness when where not many people they know about the importance of this problem in the society, especially in Western Orissa at the districts of Bargarh, Balangir, Sundargarh, and Southern Orissa in Nabrangpur. The problem is on. Previously, we had a breakout at Keonjhar, and then this changes from year to year. At Odisha, for last few years, we are seeing cases. 10, 15 years, SCB records discrete cases, and we treat the patients to good health if they report early. But of late, after 5 deaths in Bargarh and 150 detections in Sundargarh, this has become a headline. And it's better in next half an hour, I tell you something about the disease which will help you to fight it out. Because it's not that it's inevitable that you'll suffer from the disease. So let us see the problem in these headings. I'll tell you about the organism which causes the disease, the history and the epidemiology, how it started and how the country and the state faces the problem, the transmission, which will give you a knowledge how to protect yourself, the disease in humans, the prevention and the control. So let us see about the organism. The organism, as I told, is a oriental Shushugamushi. It's a rickettsial Provazacki, and it's an obligate intracellular bacteria. It's a pleomorphic rod susceptible to moist heat and dry heat. So what happens? There are mites which are known as chiga, which bite the human skin, and that after the biting forms a small lesion called the scar. And after this obligate intracellular bacteria, the rickettsia, enters the human body, it goes to the circulation, lymph nodes, and different organs. And how the disease spreads, if we understand, we can check it further. Taking you to the history, in 1489, the arrival of this rickettsial disease in the Europe took
Sir,
place.
good evening.
Yeah.
Aditya, sir, the slide is not actually running it. One
Yeah,
slide is
yeah.
stagnant.
Yeah, that's what I wanted to know. It's not changing.
Yes, sir. Not changing,
We are
sir.
in
Yeah,
the,
No.
we are in the first slide.
yeah.
Same
No.
slide, yes, sir. You are in flash slide, sir.
Yeah. I'm MG sharing this.
Okay.
Slide not changing. The same problem.
Yes, it is doing.
So it's changing now.
Yeah. No. Yes. Yes.
Yes,
Yes,
sir.
sir.
Yes, sir. Changing, sir.
Changing. Yeah. So this is what I told you. We'll go through these subheadings and about the organism. It's a rickettsia, which I told spreads through a mite, the commonly known as chiga, which bites the skin. Where this mite stays, usually those who work in the paddy fields, in the green, lush, moist, mud, and the paddy fields where a lot of grass and the plants are there. Therefrom, it comes to the human skin. And the other way is the rodents or the cattle or the sheep and the goat, as well as the pet dog and cat. They can bear this mite in their skin, and from their skin it enters the human skin, but there is no report of human to human transmission. So I'm taking you through the history. In 1489, there was arrival in the Europe, and soldiers returning from shipwreck were reported this infection, where the black eschar was found in the skin. They had jaundice, they had vomiting, and pain of whole body. In 57-59, the outbreak in the England was reported, which killed around 10% of the population, and all who were in the poor sanitation suffered. 1880, the typhoid bacilli was identified, and the scrub typhus rickettsia was identified. In the 17th to 19th century, the epidemics in the Europe as a result of war, disaster, or in the prisoners it was found, and 1909, it is known that it's transmission by a lice, which you know today is a mite, the chiga. 1917 to 1925, in Russia, it is estimated 25 million cases. And the end of World War II, there was already DDT used for the control, and the vaccine was on the way. So this is in the rough, the history of the disease of the scrub typhus. Let us see the epidemiology. In United States, 30 cases were reported since 1975. In Africa, in the Burundi, 1997, 20,000 cases in 3 months, January to March, were reported, and most common in people living under unhygienic condition in the refugee camp. Let me tell something regarding transmission to you. This is a live picture of the mite, the human body louse, the pediculus human corporis, which is infective. It's for 2 to 3 days. The infection acquired by feeding on the infected person and excrete the rickettsia in the feces at the time of feeding. And then this dies within the 2 weeks. So what happens? This particular mite, the chiga, it comes, it's like a louse, you know, we tell it a mite, a louse, which comes from a pet animal or from a cattle or from a sheep or goat, and it stays nearby the bed. Those who don't change their bed sheets daily, those who don't clean up their living space, usually these mites, they live in the bush, live in the animal skin, and when human comes in contact with them, they infect the human skin. But if the environment is clean daily and people wear dresses of the full sleeve, they don't cause any problem. So the louse species is dropped into bite the superficial abrasions. So there occurs sylvatic typhus, where the flying squirrel is involved, and 30 human cases were reported in the US. So the most important transmission pathology for Odisha and our inhabitation is even rodents, where the mice skin can be a home to the mite, and also the pet animals like a dog, the cat, or the animals which are around like goat, sheep, and the cattle. And directly human can come in contact with this mite in the paddy field. There is no person-to-person transmission or human-to-human transmission. So once the mite enters the trigger, enters the skin, it produces an inflammation which heals by a scar known as the scar, and the mite enters the circulation and goes to the human body. And the common symptoms, the incubation is around 7 to 14 days. There occurs high fever, chills, headache, cough, and severe myalgia. The classical presentation is fever, pain in all over the body, and then severe headache. And at times it affects the liver, kidney, lungs, brain, and you may get coma, you may get a renal failure, you may get a jaundice, and usually the patient becomes symptomatic in the 2nd to 3rd week of the attack by the trigger or the mite. So we have confirmatory diagnosis by the IgM test, which is done by the ELISA method. And the ELISA test is done in all district headquarter hospitals, in the medical colleges, and even diagnostic laboratories like RMRC and the ILS. And this ELISA for IgM detects the infection with the scrub typhus. So the summary of the detection is anybody who is presenting with the fever, presenting with the pain in all over the body, presenting with the headache, presenting with the features of vomiting, jaundice, decreased urination, or altered mentation, we have to test for the scrub typhus, and the test is done usually by ELISA method, the IgM, and the early detection is very early, very relevant. If we detect them early, we can treat completely because we have antibiotics like doxycycline, which 100% sensitive to the infection at present. So the case fatality rate is 1 to 20% with antibiotic treatment and 100% without treatment. The issue I want to tell you now, if you come to the doctor early, doctor detects you early and treats you with a proper antibiotic, chances of recovery is very good. If you come late with organ involvement, maybe liver, lungs, kidney, heart, and the brain, there is 100% mortality. And those who are with the different comorbidities, say diabetes, say hypertension, say obesity, say heart disease, say pneumonia, say cancer, say the different collagen vascular diseases, elderly people, pregnant ladies, small children, immunocompromised patients like tuberculosis and HIV, they are more at risk of having a severe course of disease. The most important part I want to highlight is the prevention and the control. The clothing and the bedding has to be cleaned at least alternate day, if not daily. So you have to boil the clothes, the bed sheets, the pillow covers, and then the ambience of your bedroom, because the common time is the night where the mite enters, and once the mite enters, the infection starts in human being. So you can use the chemical control like permethrin and Temefos, as well as the carbaryl, and then biosafety levels 3, the handling infectious material, the carcasses and the lice are important, and proper hygiene is important. So in prevention, I can tell you this much: if you are properly clothed, taking full sleeve shorts and the full pants when working outside, chances of the chigoe bite is rare. And second, if you keep your environment clean, especially for those who go to the fields, they have to see that they are properly clothed and their environment is clean, especially the home environment, the rooms where they stay, and at least the bedroom, changing the linen and the bed sheets daily and cleaning them properly, where this chigoe bite is not possible. And we have seen multiple members of the family who have come in contact of the disease, where the chigoes are expected to stay at home and attack more of the members. This is also explored as a biological weapon, and the World Health Organization has also taken up the issue, the aerosolized and the stabilized species for the weeks, and that's a different part of the story. And I'm summarizing the whole story in 2 minutes time, so that we can take more questions related to the problem. So the first thing is a rickettsial disease. Crop typhus is a rickettsial disease which is caused by Oriental rickettsia. And Oriental rickettsia spreads through the vector, the chigoe, the mite, which attacks the human being through the skin, and the entry point of the chigoe produces a scar. And after 7 to 21 days of the bite, there occur symptoms like jaundice, like severe headache, severe body ache, fever, and related symptoms in the prodrome like vomiting and decreased urination, altered mentation or speaking incoherent, and also convalescence and the illness. When somebody has such a scenario, symptoms of fever, malaise, and a scar in the body, and also there occurs the reporting of the scrub typhus in the locality. Immediately they have to consult the hospital or the doctors, where the test will be done, the patient will be examined and will be admitted if required, and the treatment cures the disease completely. I'm very sure if you report to the doctor early and if treatment starts early, the doxycycline works 100%. Besides, if we have issues in doxycycline allergy or non-responsiveness, drugs like azithromycin and the supportive therapy also helps. So early in the course of disease, the treatment cures the patient. Late in the course of the disease, there occurs very difficult, and we have to fight with the multiple organ involvement. And regarding prevention, what already I have told, let us clean our environment, our living rooms, and those who are going to the paddy fields are visiting the different muddy, moist, and the high risk places with bushes, or with the pet animals like the dogs and the cat or the cattle, sheep and goat, that to be extra careful for the mite not to transmit them and infect them. So it's another illness which has come. Fortunately, we have a treatment, and by detecting early, we can cure ourselves. With this, I'll be happy to take the questions related to the disease, and I'm sure you can spread this message to your friends and family, and thousands of people can be protected from the disease, and we can have a better quality of life. Again, thanking the Maharshi family and Namita ma'am and the whole team for this offer, and I'll be happy as many questions as you can ask about this.
Yes, sir.
I will start my question first.
Yeah.
Dr. Jayant, I live in northeast side of United States, and there is something called tick, T-I-C-K, tick bite. Is it exactly same thing?
Yeah, actually, the rickettsial diseases are a family of diseases. Basically, they started from South Africa, and the tick are named differently. The tick which you tell is also named as the chigger, and specifically there are different types of rickettsial diseases, and the disease we see here is scrub typhus, which is by the oriental rickettsia. Rickettsia has other group of organism also, but the transmitting organism is tick only.
I see. I like to quickly, tell you my experience on this a few years back. In this side of the country, we, enjoy the summer with beautiful lawns and, greenery and moist and all those things. And in my backyard, there are a lot of deer comes, small kids and stuff. So I had a tick bite a few years back, maybe 2-3 years back, upper side of my thigh. And you cannot believe, and I was so scared, it became like a reddish in the whole area. Immediately I went to doctor. The doctor said not to worry about it. It is a tick bite, and I think I forgot the name of the antibiotic. I think it's azithromycin or something like that. That gave me, and within 2-3 days, it recovered completely. As you said earlier, doctor, my doctor also said it can affect different organ of the body. It is dangerous, and everybody should be very careful. I was not very serious when I saw the tick bite and stuff. So people over here in this area, they say like deer is the main transmission of that tick. They have a lot of ticks on their skin with their skin hair and stuff. It goes to the plant, goes to the grass, and if we walk around on the grass or kids play with that, we get tick bite. And as you mentioned in the beginning, it is dangerous, and everybody should be aware of this.
Very right, Mr. Dilip Kha. This lush green fields you have visited is the place where this tick stay, and then we have seen when we travel to the fields, or when we are constructing a house or we are visiting a site, at times there occur some organisms some material gets stick to our shoes and the pants. And then this is similar story. Tick usually stays in a bushy environment, or it comes through a pet animal to your environment, and even walks, when it crawls down to your bed and stays there to bite in a sleeping hour. And then what you had is exactly a tick bite, and what predisposes to rickettsial infection. And you have been treated either with the doxycycline or the azithromycin, which is the drug of choice at present. And because you have intervened early, you have recovered. And the same disease could have been fatal if not treated for a week or so.
Thank you for that. And my doctor said exactly same thing. It is early detection is only choice at this time. So as soon as people get this, they should see the doctor at the beginning itself.
Exactly.
Thank you, doctor.
Exactly.
May I can put a question?
Yeah. Mr. NIRANJAN ROUTRAY, sir.
Thank you, Dr. Jayant Panda. Sir, the sugar is the larval form of the mite.
No. Larval form grows to chigur. Chigur is the mite form actually. Actually, that's a infected mite. All tick, all mite, all chigur are not infected. So those
literature says that larval mite. Chigur is the larval mite.
Yeah. Actually, the biting.
हमारे सारे बच्चे परीक्षा के लिए पढ़ते हैं, ज्ञान के लिए कोई नहीं पढ़ता, और परीक्षा होते ही सब भूल, काम का नहीं होता। आज मैंने पेपर दिया, इम्तिहान दिया।
Actually, the biting agent is a mite, and the larva grows to a mite. So, as you know, in the development of the organism, the larva is an intermediate state, and larva never bites. So the organism bites, and the organism is a mite, which is known as chigur.
So carrier is rodent, perhaps.
You see, anybody can be a rodent. Carrier means it's a not biologically active carrier. You see, they work like a fomite. ये rodent के skin में लग जाता है, चाहे cattle हो, चाहे pets हो, चाहे rodent हो, चाहे fomites हो, they stick to their skin, and from their skin to the human skin. So they don't have a active life cycle in these carriers. We tell them fomite, which carries the organism from one place to other, from the paddy field, from the place where somebody visited, it comes to the home through a rodent.
परीक्षा तो खत्म ही कर देना चाहिए, क्योंकि ज्ञान की।
So the life cycle doesn't go through a rodent. Life cycle is in the human or is in the mite, and others are the carriers, means it comes through their surface from one place to the other. We tell them the fomites are the medium through which they are transferred. They don't have an active cycle there. Even animals have the infection. Rickettsial infections are seen even in animals, and then infection by the mites biting the infections, and then these mites in the unhealthy, because they don't take bath daily and their skin is not cleaned daily, they get stick to their skin. You're muted, sir. Niranjan, sir.
Only the human beings, they suffer showing some symptoms.
Yeah, human beings, they to suffer because the tinko.
Oh, exactly.
से मैंने जो उकुनी वाला जो देखा जाए, जोटा कि हम टिंको कहू, से मैंने सबू टिंको एक्चुअली इन्फेक्ट करिवेनी. The टिंको जदि इन्फेक्टेड थिबो, टिंको says that life cycle ta jo oriental rickettsia mite re au human being re hue. So the sexual cycle takes place in the rickettsia, oriental rickettsia, and there is a cycle in the human being. But human cannot transmit another human. But remember, human to human transmission is not there. See,
Okay.
মানে জনে যদি সোসাইটিরে ইনফেক্টেড হেলে বা ফ্যামিলিরে ইনফেক্ট হেলে সে ଆଉ ଜଣକୁ ଇନଫେକ୍ଟ କରିପାରିବେନି କିନ୍ତୁ ସେଇ ଯୋଉ ମାଇଟ୍ ଯଦି ଚିଗର ଯଦି 2-4 ଜଣକୁ କାମୁଡ଼ିଲା 2-4 ଜଣ ଇନଫେକ୍ଟେଡ ହେଇପାରିବେ ଇନଫେକ୍ଟେଡ ଚିଗର ସେ ଇନଫେକ୍ଟେଡ ଚିଗର and infected human being.
Thank you, sir.
So again, my doctor said, I remember this one now, that the size of the tick is like in a mustard seed. It is just so small, and sometimes it is not even visible if on your body unless you see carefully.
Yeah. It's very small, and what we show in the picture is not like that. It's a very, very small, and it has legs and it has the projections which penetrate the skin. So under the examining glass only you'll be able to see these mites.
It could be like in a smaller size of the bed bug.
Exactly.
It has legs like maybe 6 legs and one sundar like kind of needle. It is. So you mentioned a very good thing.
সামনারে দুইটা সুন্দর থিবো আউ 6টা গোড় থিবো. So if you see such an animal nearby your bed or bedroom or the garbage at your home, be very careful, spray them chemically and clean it up, and at the same time clean up your environment and the linens so that they don't bite anyone.
Okay.
Exactly. Thank you.
Sir, one more question. Which age group are more prone to such type of disease?
I have already told, actually, anybody who is bitten are likely to suffer, but those who have a immunocompromised condition, like small children, pregnant ladies, elderly people beyond 60 years, and those who have a comorbidity, like diabetes, high blood pressure, obesity, cancer, heart disease, asthma, they're having immunocompromised condition. And anybody who is already suffering from HIV, collagen vascular disease, tuberculosis, so they can acquire the infection early because the body immunity cannot fight. But anybody who is bitten by this mite or the chiga and cannot fight out the infection, have the course of the disease. So usually seen in the active people, usually those who visit the paddy field, the farmers, those who have a regular habit of gardening and going to the bushes, they're more at risk. And those who live in uncleanly environment, like in the slums, like in a overcrowded environment and unclean home environment, they're more at risk.
So do you think that they are having less resistance power or any disease affected person? I mean, low resistance power.
Those who have different illnesses and the body resistance is low or immunity is low, they're in general exposed to all the infections, not specific of this crop typhus. But crop typhus or the mite exposure that comes more in the people who are active, who go to the paddy fields, who travel to the bushy areas, and second important is don't clean up their environment daily. That's the factor where the chigar comes in contact with the human being.
Doctor, any medicine out there which will prevent this, like the flu shots or any kind of things?
No, we don't have a vaccine. The vaccine trial is still on. For the rickettsial diseases, we don't have a vaccine till now, but the early diagnosis can help. And if you have a presumption that a family member or a contact is at risk, you can give a prophylactic course of doxycycline, which is completely safe and doesn't have any side effect.
Okay.
Thank
Sir, one more question, sir. Is it contaminated? No.
No, it's not infectious, madam.
Yeah.
As I have told, human to human transmission is not possible.
Okay.
And then it's not through the feces or through the urine or through the skin contact or the cough. It will transmit. It transmits only by the bite of the mite or the chigger, which if we are preventing, we are protected. So in that sense, it has no epidemic potential. It is not infectious, and it cannot be contaminated.
Okay. Thank you, sir. May I ask the floor? Any question? Any more questions?
Yes, ma'am.
Yeah. Dibyanshu, bolo.
Sir, namaskar. Sir, I want to ask that can we go to playground to play?
Yeah, very, very important question for a child. Actually, you have to go to the playground. You should go to the playground, but not without shoes. Fine. Every time you are in the playground, you should have shoes. You should have full socks. You wear a full socks, wear shoes, and wear preferably a full pant which covers your leg. If your feet and leg are covered, there is no chance that this chigger will come in contact of your skin, and you are protected.
And while
that
coming
means
back,
you can play. Sorry, that means you can play cricket but cannot play kabaddi.
So when you are going specially to a bushy field to play football or kabaddi, as the lips are told, you have to be extra careful. But at our end, we can cover things well, and then if possible, also wear the gloves along with the socks, and then no part of your body is open to be bitten by a chigger. Usual part bitten are legs and the hand, because those are exposed and they're easily come in access with the grass, bushes, or the other animal skin.
okay, Dibyanshu. Got. Hello.
Madam, last question more thila.
हाँ पचारंतु sir.
Jayant sir, mortality rate कौन रही?
ମୁଁ କହିଲି ଯୋଉଟା ଆପଣ ଯଦି early detection ହେଇଗଲା, it can be completely treated. ମାନେ fortunately ଆମ ପାଖରେ ଔଷଧ ଅଛି ଯାହାକି ରୋଗକୁ ସମ୍ପୂର୍ଣ୍ଣ ଭାବରେ ଚିକିତ୍ସା କରିଦେଇ ପାରିବ। ବେଶୀ କଷ୍ଟଲି ବି ନୁହେଁ। ଆପଣ ଜାଣିଛନ୍ତି ଡକ୍ସିସାଇକ୍ଲିନ୍ କ୍ୟାପସୁଲ ବା ଡକ୍ସିସାଇକ୍ଲିନ୍ ଟ୍ୟାବଲେଟ, ଏଜିଥ୍ରୋମାଇସିନ୍ ଟ୍ୟାବଲେଟ ରୋଗକୁ ସମ୍ପୂର୍ଣ୍ଣ ଭାବରେ କ୍ଲିୟର କରିଦେବ during the first week of the detection. ଯଦି ଆମେ ଇନିସିଆଲି ଗଲେନି ବା ଟ୍ରିଟମେଣ୍ଟ ନେଲେନି, ପେସେଣ୍ଟର ରିନାଲ ଫେଲିୟର ହେଲା, ଜଣ୍ଡିସ ହେଲା, ଏନସେଫାଲାଇଟିସ ହେଲା, ମଲ୍ଟି ଅର୍ଗାନ ଫେଲିୟର ହେଲା, ସେ ଟାଇମରେ ପେସେଣ୍ଟକୁ ଆମେ ଆଇସିୟୁ ରେ ରଖିଛୁ, ସପୋର୍ଟ ଦେଇଛୁ, ଆଉ ବହୁତ ପେସେଣ୍ଟ ଲୁଜ ବି କରିଛୁ। ଏଇ ଯୋଉ ଡେଥ୍ ଆପଣ ଦେଖୁଛନ୍ତି, that is because of the negligence, non reporting in time. So ମୁଁ କହିବି ଯେ ଆପଣ ଯେତେ ଜଲ୍ଦି ଆର ସସ୍ପିସନ ହଉଛି କି ଲୋକାଲିଟିରେ ଅଛି, ତୁରନ୍ତ ଡକ୍ଟରଙ୍କୁ ଦେଖେଇକି ମେଡିସିନ ଖାଆନ୍ତୁ, କିମ୍ବା ଯଦି ଡକ୍ଟର ଏସେସେବଲ ହଉନାହାନ୍ତି, ୟୁ କ୍ୟାନ୍ ଷ୍ଟାର୍ଟ ଏ କୋର୍ସ ଅଫ ଡକ୍ସିସାଇକ୍ଲିନ୍, ଯୋଉଥିରେ କି ଏଇ ପ୍ରୋବ୍ଲେମ ପଳେଇବ। ଡକ୍ସିସାଇକ୍ଲିନ୍ ର କିଛି ସାଇଡ ଇଫେକ୍ଟସ ନାହିଁ। ଇଟ୍ସ ଏ ସେଫ୍ drug, safe antibiotic which can kill the rickettsia. ସେଟାକୁ ଆପଣ ଆରାମରେ ଆରମ୍ଭ କରିଦେଇ ପାରିବେ। ଯଦି ଡେରି ହେଇଗଲା, ପେସେଣ୍ଟ ମଲ୍ଟିପଲ କମ୍ପ୍ଲିକେସନ ନେଇକି ଆସିଲେ, there is a chance of mortality.
Sir, in your last part of the discussion, you have mentioned about the role of these scrub typhus as bioweapons.
Yeah.
Is it in or is it the outcome? This menace is the outcome of the trial of bioweapons.
No. This oriental rickettsia has been blown to the countries. You see, in an infection, two factors. One is the organism, one is a vector, and human is a sufferer. Human is at the end of the infection. Whereas human doesn't spread the transmission. So once the human beings are infected, human beings are sufferers. So we have few things which are used as a biological warfare. You know about anthrax, you know about the bacteria and the different spores used for the infection, and the oriental rickettsia is one among them, which are misutilized by a few countries for the biological weapon or biological warfare. So in that they spread the oriental rickettsia. They don't spread the mite. Mite are there everywhere. These mite are not infected or mite bite. Every mite bite is not fatal. But once the oriental rickettsia is sprayed or the blown into the country or the environment, that infects the mite, and mite bites the human being, and the human being is infected and suffers the disease. So that's a WHO declared agent for biological warfare.
Thank you.
I think Poonam wanted to ask something.
Okay. No hands. Anybody want to ask any question? Yes. Please
Sir.
unmute your. Yeah. Dibyansu, once more.
Yes, ma'am.
Okay.
Sir, I want to ask that these mites bite in daytime or night time?
Mostly nighttime. Right question. Mostly nighttime. But those who visit the paddy fields and the bushes and the, suppose you go to the playground, obviously you will not go in the night. You will go in the day. So they come in contact of your skin, and they are carried home also in your shoes, socks, or the dress. They can move around at your home, and they can bite during the daytime also. But those who are at your sleeping environment, in nearby your bed, they'll bite during the night time. That's why while sleeping also, you should cover yourself fully, so that mite walks on your blanket, doesn't walk down to your skin.
I think that is the reason our forefather has been telling us that, you know, when you go out and come back home, just clean your hands and legs.
Wash.
And you know,
Yeah.
all those things. And especially kids, when we go out, we used to, our parents used to tell us, if you go out, dhuli is not a problem, but you know, this kind of insects is a problem. So come clean your feet and hand and face and everything, then come inside the house.
Yeah. The wisdom in that entering the home from outside, cleaning your hand, feet, and body parts is that. And also when you visit a funeral ground, when you come, usually funeral grounds are bushy, not well maintained, and they outskit in the river bed. So there are chances of carrying the mites and the organisms home. So they were asked to take a bath and enter home.
And also we were told from childhood that, you know, keep the shoes away from home, like juta rakhewa ko tha. But our culture has been changed. We wear shoes and come inside, and without taking it out, we sit in the sofa and living room and drawing room. So those culture has been changed.
Yeah. Perhaps only place is hospital where people respect to take out shoes while entering a ICU or ward. But other places, people think it's a heart of ego if they're asked to take off the shoes. But that is for the good hygiene. Also, right? All living places should not have shoes. Shoes protect you. But if you're carrying the shoes to your living places, you are carrying the bacteria, organism and infections also.
But if I am wearing a good shoes, I need to show off also, right? So that is the reason.
Now the science has found out a solution. We have shoe covers. There are machines which are covering your shoes. So you can put where people want to or need to enter with shoes, you can put a shoe cover machine. Just you have
Oh.
to put your shoe inside. It
Uh-huh.
it shields. You come, go and take out the cover and through, and you go back to your home. That can be possible also.
Okay. Feel like things. Chale. Yeah. It's a nice thing. Sir, the last question maybe. Sir, तार जो breeding places टा कोठी हबो? यदि suppose पळे आसिला किछि mites गुडा मस जो तारे असला भी कोठी असला सेठी कोन तार breeding place भी सेठी पारे? Chances is there.
Yeah. If they find out a dirty place even at your home, they can breed there.
Okay.
Payal Sahu has raised the hand to ask a question since long. So if she wants,
Good evening, sir.
Yeah.
tell your question.
Sir, by using which insecticide we can kill that insect?
Yes. All as I told, the chemical insecticides are available, and you can use for the spray. The pyrethrin can also be used, which we use for the mosquitoes, and we can use the common insecticides like a organophosphorus compound, which we are using for the lice. We are using for the this termite, that can also be used. But you have to be very careful because it has a toxicity and poisoning reported. But if you suspect your home to be infected, you can use this compound to clean up the mite.
Okay, thank you, sir.
Payal, you are from? Can you introduce yourself?
Good evening, ma'am.
Yes, commerce.
Ma'am, I am from Bhubaneswar and I am the student of BANKI Autonomous College.
Okay.
NIRANJAN ROUTRAY sir is my lecturer.
Okay. Very
evening,
nice
sir.
of you. Very nice. Jaybir Singh sir from Maharashtra.
जी
Any
नमस्ते, सभी को नमस्ते।
Okay.
हाँ जी, बहुत बहुत धन्यवाद सर का। सवाल तो नहीं है मेरा कोई।
Okay. Professor Satish ji.
जी मैडम।
Yes. Any question? Because your place is very susceptible. Madhya Pradesh. Yes. आपको कुछ क्वेश्चन पूछना है क्या?
ठीक है भाई, सुन रहे थे, बहुत अच्छा लगा।
Okay.
थोड़ा सा हमारे बाहर से लौट रहे थे, गाड़ी में हैं, अपनी गाड़ी में हैं।
Okay.
लेकिन मैं सारा कार्यक्रम को देख रहा हूँ, सुन रहा हूँ।
It will be useful for you. You can share these slides to your children, I mean your students in the university, Jharkhand. Okay. Sunita ji from Bokaro, are you here? Okay. So if you don't have any question, we can wind up now. Right. Now it's time to extend our thanks from the core of our heart to a small memento to Professor Jayant Panda sir. We'll be very much happy, sir, if you will be with us in the next few days. If you will have any type of advice during this period, because every day we are expecting anything can be happen to our health. So at that time, we need your help, sir. And please accept this virtual memento on behalf of this webinar, sir.
Thank you, madam. Thank you.
Thank you, Jal.
And one more, Mr. Dilip Khap, he joined all the way from US, and we want to present this certificate to him. May I request Professor Jayant Kumar Panda sir to hand over virtually the certificate to Mr. Dilip.
Yeah, my pleasure. And thank you for your interest. Thank you for sharing your own case history in the related story, and then it's an honor for me to felicitate to you.
Thank you, thank you.
Felicitate you with this certificate.
Dr. Namita is okay. Got it now. Your screen was not visible. Now it is.
Okay. Thank you. And now it's time to extend heartfelt thanks on behalf of our webinar team. May I request, please unmute yourself, Mr. Niranjan Raut, sir, the reader in zoology from BANKI Autonomous College, who will extend vote of thanks. Please propose a vote of thanks. Yes, sir.
Thank you, Namita madam. Good evening, all. So it was a nice evening with a very burning topic we have discussed. Jayant sir, thank you very much. And we expect more to listen from you regarding leptospirosis in the near future or within a couple of days. Definitely this bit of information will surely help the small volunteers to spread awareness in their society and to create awareness among their family members, especially in the rural areas. So I thank you from the Prof, Dr. Jayant. On behalf of the Rovers and Rangers MCNL, thank you, sir, for extending your support and spending your precious time with us. I also extend my thanks to Dilip and all the participants in this platform, and Namita madam also, who have cordially organized this very nice webinar. And my special thanks also to Dr. Pmspeaker, Chief Patron. I wish that in the near future also the similar type of gatherings will be made in the same platform. Namita madam.
Thank you, sir.
Thank you.
And
Thank you.
we are really grateful, sir. And this webinar recording and these slides will be very much helpful. And we will try to share it almost all the participants and all the members, those who have not joined here, but we'll share it because it will be helpful for all of us. Thank you, sir, for being with us. Sanos.